So good morning from Seattle, Washington. This is Dr. Nadeem Zafar. I'm the Chief of Pathology at the VA Puget Sound and Associate Professor at University of Washington Department of Laboratory Medicine and Pathology. I was a program director or residency program director between 2012 and 2017 at University of Tennessee, and actually became the president of the Program Directors Council at the national level. And feel I've contributed quite a bit to the residency process for pathology, worked with excellent colleagues doing that. Today, and I'm honored to have been invited by the Pakistani-American Pathologists Society to talk to you all about successfully interviewing for our pathology residency, and especially in the time of the pandemic, as we are now doing virtual interviews. And this is something we started last year and actually had a very varied experience. And I will share that with you during the course of this presentation over the next 30 to 40 minutes. And then we will have a question and answer session. Now you can put your questions in the chat section as well, but I will answer them at the back end. And I look forward to working with the moderator to answer those questions for you as we move forward with this presentation. So let's overview the presentation itself. I have no conflict of interest. In the questions we will be addressing during the course of this presentation is, why have you been asked to interview? What is the difference between the in-person interview versus virtual interview? What are the technicalities of virtual interviews? How to talk to program members, not just the program director, but the program members, including the coordinator, director herself or himself, residents, fellows, other pathologists, or anyone else. And what happens if things do not exactly go as planned technically or during your answers? And then how should you follow up? And actually, should you follow up or not? These are the questions we will discuss during the course of this presentation. So why do you think you have been asked to interview at a particular program? And there are some points that we will go over, but take it to your heart that you are a serious contender. Your application may not be perfect. Most of us don't have perfect applications, but you have done many things right. And that's important. That's really, really important. The program believes that you are committed to pathology. And it's interesting, and this is something that, from a program director's side, I'm letting you know, even if you apply to other fields of medicine, the program will typically not know about it unless you own up to it. But if they find out, you will be ranked low, because that might show to them that you're not very committed to pathology. And my advice to you is actually do not apply to pathology if you're not serious about pathology. It's a wonderful field, but it's not for everyone. Also, your letters of reference and your personal statement must be very good, as must be your USMLE scores. Perhaps your work experience as so far as right now. And you may have also done, and what does make a difference for someone like me and other program directors, if you may have a strong volunteer or teaching experience in which you may become highly desirable for the program. It shows your commitment to humanity and for passing on the message of pathology to others down the line as a teacher. My experience so far has been, unfortunately, candidates from Pakistan do not come with a strong postgraduate experience. Some do, most do not, unlike other nationalities. And you may be that rare bird with strong research experience and papers. And if that is okay, then you may be highly competitive for research-oriented programs such as Ivy Leagues, or also University of Washington, which is my program, and strongly favors research background or research experience. The program also, it's very true for any nationality, not just for Pakistani, but the program may have a very high-performing Pakistani resident. But if there was a selfish or a troubled Pakistani resident in the program, they will certainly keep you out of that program. And this is what I want you to remember going forward in your own experience when you do your own residency, that if you do well, you will open up doors for many more who follow in your footsteps. So what's the difference between in-person interview versus virtual interview? And the programs are trying to make them very similar. They're different, but as the experience builds up, they're trying to make these very similar. And I think that's important because it makes it easier for the interviewers as well as for the interviewees themselves if the process is, and they try to replicate that process to represent what in-person interviews used to feel like. Now, traditionally, virtual interviews, not just in our field or in the field of medicine, but they can be one-way or two-way. And one-way interview is something which is not typical for medical residency, so I will not talk more about it. And typically, what you will have is a two-way interview. Now, the biggest challenge for us, as well as for you perhaps, is that how do we judge each other's fit, your fit for the program, and for me, your fit into the program. Because there's much of missing interaction during virtual interviews, especially in the real interviews when we kind of were together, there was a lot of interaction in a non-work type setting. So for example, lunch, dinner, or we went out or to a bowling game or some other activities that give us some sense of your social skills as well. And that may be missing during the virtual interview. So a lot of programs are now doing virtual lunch with residents and fellows. So BYOL means bring your own lunch. It's very important for current residents to gauge you, the candidate. And I can tell you about my program when I used to interview, that if you, for example, came and interviewed to my program, and if the residents did not click with you, then you could be Albert E. Einstein, for example, but we will not take you because we want to make sure that there's a good fit between the program and the candidates. And that fit includes how the program coordinator feels about you and how do the residents feel about you. This is not about bias, this is about fit, totally different subjects. I can tell you this much, and reading the reviews as well, confirming what my thought is, that the faculty, in fact, is still adjusting to virtual interviews. Many of them were not very happy with the virtual interviews last year. And that experience may be better this year because this is an experiential process. I think it's very important for you all to know before the interview about the city, before the interview, not before joining, before the interview, so you have some sense of why you are applying to a certain program, not just for the strength of the program, but the city it's located in, what kind of facilities do you have in that city, would you be able to survive in that city, what kind of a support mechanism is available from the hospital or the university system. So know about the city, hospital, and the university, the program, faculty, and residents. And if you have local connectivity and you bring that out during the interview process, the program actually may rank you higher. It is also important that you fully understand the interview process. You are welcome to ask the program what the process will be, know it very well, don't have lacunae or the spaces in your understanding of the interview process. You don't want to mess it up. And have exchange telephone numbers. So it's possible that during this virtual interview, there may be some issue or complication. So at least you can have a telephone interview if your computer doesn't work or something happens or light goes off or whatever. In that, this is just for technical issues. So have that backup number. And, many of the conference software will provide you with that option also. So keep that number handy. So what about the technicalities of virtual interview? So the question is Wi-Fi better versus wired? And in general, if you read about what the experts say, that they always, and it makes sense that the wired connectivity is better. And make sure your game consoles, TV, etc., are off so that they would not steal your bandwidth from you, and then you might have flickering or interruption during the interview process. That would not go well for you. Know well the interview software itself. Check with the program and get familiarity. It could be Teams, Zoom, Google, whatever they work with, and there are multiple different ones, and know them to some extent, read about them, check them online and YouTube and all. Other questions, so what computer should you use? Should you use a laptop or a desktop versus telephone? And the answer is do not use the telephone. Use either the laptop or the desktop. And the camera should be placed slightly above your face level. In my case, this is at my face level, and I've got a box on which I have this laptop, but it should face slightly above your face level and looking down at you. And then you look at the camera itself. The camera should not look up your nose or up your teeth with food sticking to it. And then in that case, you will be looking down at the interviewer, which is not a good thing to do. In your computer, switch off the alerts. You make sure that you don't have these pings going on, because it will distract you from the interview process itself. And do test the system well. Make sure that the speaker and the sound, the mic is working well. And you can use headphones, or again, wired are better, but wired should do fine also. And then speak in the camera. And if I were you, I would put a sticky next to the camera itself, so that you keep looking at the camera, not on the computer, not elsewhere, basically, because the eye contact is going to be through the camera itself. As far as the light goes, it's good to have either you face the window or get a warm light which faces you, and it's focused on your face. And you can also put like a small white sheet underneath your laptop, so that the light reflects up onto your face and gives you a form. In my case, you're getting a little shadow, for example, but if I had a white sheet here, the light will reflect up to me, and that will give you an even lighting, and it makes the camera visibility better. As far as the background goes, in my case, you see there's some paintings and stuff. I would not put anything busy. I would keep the background soothing, maybe a plant or two, but it should be a quiet background. What could go wrong? I mean, the things can go wrong, obviously. So like I told you, although you're using computer audio for your interview, but have the conference telephone number handy, which will be provided with the conference, so that in case your speakers don't work, or something else happen, you will be able to connect with the telephone. What about camera trouble? Make sure you have a photo available for them with your interview paperwork. So let them know you're having camera trouble. And it's kind of interesting that the interviewers ideally, they should leave the camera on. That's a human thing to do. That's a courteous thing to do, but they may not do it. They may be busy doing other things while you're talking, which is not what they're supposed to do, but people do what people do. So, if the interviews are, they're switched on the camera, don't worry about it. Speak to your camera and then expect that they're looking at the other end and they're seeing at the other end. Don't be rattled about it. You leave your camera on. You cannot afford not to have your camera on. What if a neighbor's dog keeps barking during the interview? And if you look at the software in the Zoom, you can blunt out the background noise. There are 3 different levels in the setting that you can do blunting out that noise. But if you can't do that, apologize. People understand. People have kids in the background. They have cats and dogs and all. Life goes on in the virtual environment these days. What if there's an emergency during the interview? Again, apologize. Let them know what's going on, and either come back to the interview if it's something short, like your kid, fell or something, bumped the head or something like this. Or you may want to reschedule the interview. Either way, it's fine, but let them know what goes on. And if the program doesn't understand that, then that's not the kind of program you want to go and work for or train with. Now, what if you made a factual errors during one of the answers and it doesn't read your CV very well? It should be like the back of your hand, that you should know it very well. What you have done, and it better be an honest, very honest CV. Know it really, really well, because you will be asked stuff from your CV, and your answers should match with that. But should you, make an error, not deliberate, but it's a factual error that you made, then let the program coordinator and or the faculty member who you made that error to know what happened, and you apologize for it and move on. Basically, your credibility is important. I cannot emphasize enough. If I, as a program director, found a discrepancy between your CV and what you're telling me, and then you're almost out of that contention for that program, be very honest about it. Do not claim anything that you have not done, basically, because if it shows up during the interview process, you will lose everything. And the key important thing is, and this is not funny, but I'm telling you, keep breathing and keep smiling. When you're stressed, you will see your breathing pattern changes and the smile quickly disappears. And nobody wants to hire a grumpy resident, basically. So, keep breathing and keep smiling, keep focus on the question, keep focus on the camera. In your social skills, just having 400 or 800 or 1,200 Facebook friends doesn't make you a social success. So just to let you know on a lighter side. Let's talk about the interview itself. In a smile is a critical thing. It's unfortunate that when we come from some parts of the world, smile is not native to us, but smile is very native in this country. And the more confident you are, the more your smile will be rare and the more it will be appreciated by the people. So smile and greet. Thank the interviewer for talking to you and do it early because you may not get a chance at the back end of the interview if it's disconnected or something happens or your time is up. So thank them upfront for interviewing you and for talking to you. Learn the art of casual communication. And I cannot tell you how important that is. There may be this social conversation on how has your day been so far? How's the weather you are at now? This is interesting because you may be interviewing somebody, and maybe interviewing someone in a different country altogether, different time points, different time zones, and all of that. So those questions become even more relevant. And some of the interviews may actually not ask you much, and they say what questions you have about the program. And that could be a very early question because what they want to see is to give you more time to ask. And also it's a role reversal to see how critical your thought process is, how important it is for you to know where you're coming to and what kind of questions you have about the program. Even if you have asked these questions elsewhere, make sure you ask questions from everyone, because if you don't ask questions, that means you're not interested. That doesn't go well. There could be some behavioral questions, and those behavioral questions may include, for example, I'll give you an example. You are a resident on call, you get a call, which is a difficult one. You call up your attending on call who does not respond. It's 3 in the morning. He's tired and he's or she's tired and she's sleeping. What do you do next? Or something like, what about your senior resident colleague who appears not to be well or intoxicated at work? These things happen. What do you do next, basically? Give them an honest answer. Think about these questions. At least for the first one that, I was on, call as a resident and I couldn't connect with my attending. So I had to look for a senior or a colleague to help me with. But these are all real questions. What about situational awareness? So for example, you got a fascinating case of XYZ and you have photo micrographs. Should you share them on social media? We get excited, we take pictures. Should we share them on social media? And if yes, then what should we know before we share those photo micrographs with the rest of the world? What about patient confidentiality and all? So know a few things. You could be asked anything. They don't necessarily expect you to have an answer, but they understand that the interviewers like me understand that you are from a different world, a social media type world with very broad connectivity and all of that. And we share everything these days, but that doesn't mean we should share everything. And I think that's very important to be ready for questions like that. Why did you choose pathology? And what is your other passion in medicine? Now, this is very important. Now, in this case, they're not asking you this question, what is your other passion in medicine? Because they think you might be applying elsewhere. So for example, when I was applying for PATH, my second choice would have been surgery. I didn't care much about medicine, but I cared much about surgery, enjoyed surgery, did very well in that. And I was honest about it. I mean, I still, love interacting with surgeons. We do that all the time. So there's nothing wrong with that. Question like, if you're not, and this is one of my favorite questions, I ask them with a lot of candidates. If you're not become an MD, for example, what would you have been your other option, for example? I love cooking. I love, this is a taste I've developed over years now. And I probably would, as in my retirement also, I'll get some more chef type training and all. I enjoy it basically. It's something that relaxes me. I get to eat good food the way I want to cook and all of that. So it's perfectly fine to have and you should have these other choices available. And in a question maybe asked, for example, someone wants to know about training in Pakistan. You've trained in Pakistan. They want to know how good that training is. So they might want you to compare the training opportunities in Pakistan versus US for pathologists, for example. Now, do not forget that most of the local pathologists in Pakistan who are very well trained are locally trained. They've not traveled to UK, might have gone there for conferences and stuff, but a lot of them are locally trained and providing excellent service. Don't try to poo-poo a system which is producing very nice pathologists through local training as well. Different from US or European or US training, but still very good. You might be asked about an interesting case where pathology was great help for management. Know about this. If you've worked in pathology, that should come natural to you. If you don't have a sense for this case, pathology is not for you. Because why would you come to pathology? Why did you decide to choose this field? If, for example, as a term that we use is called cop-out choice, COP out choice, cop-out, meaning that we couldn't find training opportunity in other fields than coming to pathology. That generally is not considered very well in pathology. Question, open-ended question would be, what are the headwinds for pathology? Know about it, because your future depends on it. For example, is augmented reality, microscopy, or artificial intelligence, is that a headwind or an opportunity? Headwind meaning that's something which will impact pathologists or which will boost pathologists, and it will do both as far as I'm concerned. Other question might be open-ended. Is cancer diagnosis moving away from pathologists to commercial molecular enterprises? Very real questions. A lot of cancer diagnosis is moving that way. And essentially at some point, the question is, would we move from H&E exams, or would we move from immunohistochemistry or other tests towards molecular testing only? Interesting questions. You can be asked about those. Do you have a favorite subspecialty in pathology? Especially if you have done training already in pathology, it is expected you might have formed an opinion. If you have not done much of training, then you can say these are the fields I like, or this is something I've considered. But I would know more as I grow more in my training. The next question is a critical question. What do you know about our program? I know a lot of you are trying to get into one or the other pathology program or residency. Doesn't matter which one, but know about the program, because even the weakest of the program has a certain amount of pride, and they want to know what you think about the program. Also, learn to understand EQ or emotional quotient or body language, because their program where the residents may not be very happy. You need to understand that. You need to tease that out. Know the strengths and the weaknesses of the program, basically. You might be asked illegal questions actually they shouldn't be, but they can ask, you might be asked illegal questions. So for example, questions about your race, ethnic origin, marital status, sexual orientation, disabilities, what you can or cannot do, where else are you applying? These are typically questions best avoided, should not be asked of you. But if you ask, you use a technique which is called a stretch technique. Use your judgment and politely use that stretch technique. Move away from an answer related something, not directly. You don't have to directly answer that particular question. But if they ask you about your favorite cuisine or a travel destination, this is absolutely not illegal. And this is something we talk about all the time. What about humor? What about cracking jokes? If you feel like a cracking joke and you're high in your confidence. In general, our taste for humor is varied. If you follow the interview gurus who kind of coaches and all, they will tell you that a small amount of self-deprecating humor that is on yourself, if you made a boo-boo or something, is okay, is good actually. But my recommendation to you would be to keep a smile, keep breathing, but focus on the interview and don't crack jokes and all. You never know which way it's going to go. The other question is asked is, should I give a short or a long answer? In general, use your best judgment, but in general, short answers are better. Stick to the point, stick to the question. But if there have been gaps in your training, if there's some issue, something needs a clarification, do not give a short answer, then help them understand. They might ask you if there's a gap. You might have taken 2 or 3 years off to take care of an ailing parent or raise families in Ireland. It's perfectly understandable, perfectly accepted. So use your best judgment for these long-winded answers. And again, keep breathing, keep smiling, because the latter does not come natural to most of us. What is the elevator speech or elevator pitch? And this is something I think which is very important that you all need to practice on. It's in essence, it's called elevator pitch. It's a brief 60-second way of introducing yourself, getting across a key point or two, making a connection with someone. It's not your life story. It is in the strongest, in the most concentrated sense, telling them who you are, what is your strength, what are you made up of, just a couple of points basically. It is called an elevator pitch because it takes roughly the amount of time you would spend riding an elevator with someone basically. So if you have time, you're going up from ground floor up to maybe 10, 20 floors up. How would you introduce yourself to somebody? Because after 20 floors, they will just go out and that will be the end of the story. That's a chance to sell yourself, tell them your most strongest point basically. How will you introduce yourself, get your point across and ask to stay connected all before that person gets off the elevator? That's called the elevator pitch. These are handy to have anytime you are at an event. Get used to doing those, keep thinking about those. Again, be honest about it. It's all about honesty, but conviction, your strength, your emotional maturity, your ability to stand behind what you're saying. And this is, so if you have any time, you're at an event where you might meet a prospective job or networking connection, which is like this setting basically. So who am I? What do I do? Your skills, values, passion, and what is my ask and what are you looking for? So again, who am I? What do I do? The 3 things in an elevator. Who am I? What do I do? And what is my ask? In other words, what are you trying to get? You would love to be in that program because XYZ. This is what you're bringing. This is what I do. This is what I promise to you. And I would love to be in your program because of this. And something to remember you by from all of the candidates. How do you end the interview? Make sure that you ask, if you get a chance, ask at least 1 or 2 questions from every interviewer, even if you have asked the same questions from others and got the answers. You have to ask questions. Do not say, oh, I don't have questions. And I've had candidates do that to me. And you're sitting with the program director and you're saying that I've had all my questions asked. That means that you have no idea what a lot of the program is all about. Thank the interviewer for their time and how you enjoyed talking with them. Common courtesy. This is something that I enjoyed. I've been asked this multiple times by smart kids. You can ask them for their mentoring advice. So as someone planning on entering the field of pathology here in the US, do you have any advice for me? Simple question. This is the kind of questions that the mentors love to hear basically before they take you under their wings. Reaffirm your elevator pitch that we just talked about and let the interviewer know why you think, this is at closing, at ending the interview, why you think entering that training program is so important for you and how you can contribute to the program. It's a two-way communication that you are giving them confidence for them to understand and be complimentary of what that program is. And make sure you close the process by thanking the program. When the whole day is closing, before you close that, thanking the program coordinator and the program director. As far as email or a card handwritten to the program coordinator and program director, thanking them for their hospitality, even if it's virtual, and why you are so keen to match in their program, reaffirm it, handwrite it. Email is good too, but handwrite the card, send it to them, makes a ton of a difference. And then if you are religious, then do dua for your success, seek divine guidance, and have patience and gratitude for what you have already achieved so far in life. Here are the resources that you might find useful to ace your interview. And I would hope when this presentation is made available, you should be able to use these shortly. There's a lot of good resources in there, use them. and learn a little bit more about what we just discussed today. And with that, I will stop. If there are any questions from me, I will take the questions from the chat as well, or open up the mic as the moderator decides. I thank you for your presence today. It's been wonderful talking to you, and I wish you all glowing success. And thank you again. Best of luck.